Relatives try to help loved ones suffering from COVID-19 at a hospital in a small town in North India. In a village, people with symptoms of the deadly virus are treated outdoors because residents said they had no option of accessing health facilities.
When people go to a hospital, they hear that there are no beds, there is no treatment available, and there are no doctors or healthcare workers. When they go to private hospitals or doctors' clinics, they get just a prescription for medicines. Patients are helpless.
In villages, grieving families tell stories of how they are losing loved ones to the virus as the pandemic's second wave rages in rural India after slowing down in big cities such as New Delhi. Prime Minister Narendra Modi has sounded a grim warning.
This infection is now spreading to villages very rapidly. All governments of the country are trying everything to stop this. The awareness of people in the villages and the cooperation of the village governing bodies is just as important in controlling this spread.
The government says it will increase the number of hospital beds with oxygen support in rural districts, which usually have ill-equipped health centres. But the challenge is in meeting the demands. Even in big cities, modern hospitals, isolation and testing centres were overwhelmed and oxygen supplies ran short. Such facilities are sparse in rural areas.
You may have some in the semi-urban areas, but nothing close to what you're having in metros in terms of sophistication, both in infrastructure as well as in skills and capacity to be able to deal with the virus. I mean, even if you have oxygen concentrators and oxygen there, people should know how to use that. And unfortunately, capacity building has not happened to that extent.
Villages will also be hit hardest by a shortage of vaccines that has hobbled the country's inoculation drive. While older people can get a jab at health centres, India has mandated that adults under 45 must register on an app-based technology. But many rural residents do not have smartphones or internet access.
Imagine what will happen with people in rural areas who, as it is, do not have the full awareness of and benefit of knowing day-to-day changes in COVID protocols that we are being subjected to.
Health experts say a slow pace of inoculating the countryside, where 2/3 of the country lives, will make it harder to counter the fury of India's second wave. Anjana Pasricha for VOA News, Mumbai.